HyperArc is a treatment delivery system with the Varian linear accelerator and their software, largely to treating brain or intracranial lesions. Specifically, it's geared to treating multiple brain secondaries or brain metastases, and it's a very effective, efficient and accurate way to target individual lesions within the brain. Stereotactic radiosurgery has a range of indications. It can be used in non-cancerous or benign brain conditions or tumours, but the majority of cases it's used for brain secondaries. So this is when advanced tumours have spread to the brain. HyperArc is just a very accurate way to target those tumours. And the significance of that is that there's less dose to any normal tissue adjacent those tumours, which translates to less side effects for patients. Over the last decade, we've seen a real paradigm shift in the way we manage patients with multiple brain secondaries. Previously, many of these patients would have been treated with whole brain radiotherapy. Now, not only was this treatment not overly effective in controlling those lesions long term, but was associated with significant side effects for patients: hair loss, fatigue, short-term memory issues. Nowadays, there's been this shift to treating the individual lesions with radiosurgery. And with this approach, we can deliver a very high dose to the tumour to make sure that we kill them off long term. And there's very little dose to any of the surrounding tissues, which means it's very well tolerated with a very low side effect profile. When I started my practice over a decade ago, we used to only treat 1 or 2 lesions in the brain. But now, with treatments like HyperArc, there's actually no limit to the number of lesions that we can target within the brain. And now it's quite routine to treat patients with 10 or 15 lesions in the brain. Certainly nowadays, the evidence would suggest that number is no barrier to stereotactic radiosurgery or HyperArc. It's actually the total volume which is becoming more significant. If we're seeing patients even with multiple mets, rather than think about traditional treatments like whole brain, the first port of call should be consideration of HyperArc.